As a social worker, we end up meeting with patients here at the Maternal and Fetal Specialty Center that have some sort of additional stressors in their pregnancy outside of the high-risk pregnancy. We can connect the patients with community resources as well as Swedish resources, as well as help them cope with the diagnoses of the pregnancy and maternal diagnoses.
Many of the patients we serve come from outside the Seattle area, and I help provide services for the logistics of coming to Seattle or staying here in the area locally if that is needed. One of my roles is to help women who are experiencing depression both during the pregnancy and postpartum. My role is to assess the level of depression and to provide not only Swedish links and resources for these women, as well as community resources. One of the services that we provide postpartum here in the clinic is to have each postpartum woman complete a depression scale so that we can measure their level of depression, talk about it, because it is a very common experience following the delivery of a baby, and we want to normalize that and help those who need that help as appropriately as possible. I also help facilitate the arrangements for the comprehensive care conferences. A comprehensive care conference is designed to specifically help parents who have a baby that is going to need surgery or medical intervention following delivery. What we do is I help to facilitate having the maternal fetal medicine specialist and the pediatric subspecialist meet with the patient and her family here in our clinic, lay out the plan in terms of follow-up care once the baby is delivered and the next steps. Parents really like this because they have all their doctors together in one room. It is reassuring to know that their doctors are talking together and that they have a plan in terms of the next steps.
As social workers, we try to touch on all aspects of a person's social side of the pregnancy as they prepare to bring a baby into their lives.
I can't change the outcome of a pregnancy or change the health of a child, but I can help them cope with whatever comes their way to provide resources to them and support in that journey. And that's my reward.